Okay. Magandang araw po muli, mga classmate. Magandang araw, Doc. Pagpapatuloy po natin ang ating mga pag-aaral. Tungkol po ito sa blood or sweat. So, tingnan po natin kung ano ang blood deficiency o kakulangan ng dugo. Blood can be deficient when not enough is manufactured. This is mostly caused by deficiency of spleen qi and stomach qi. Kasi nga po ang nanggagaling pangunahin yung blood sa ating mga kinain. Kaya kung may problema po o hindi nagpapunction ng maayos ang ating spleen and stomach, magkakaroon po tayo ng kakulangan sa dugo. So other organ are implicated, liver and kidneys. So maapektuhan din po yan mga organ na yan dahil sila ay may gawain din sa pag-produce ng dugo. Okay. So blood deficiency manifesting primarily in menstrual function with scanty periods or amenorrhoea is due to deficiency of kidneys and liver. Yon, yung mga kulang po ng dugo na mga babaeng nagme-mens, yung nagtataka kayo bakit biglang napakakonti nung nilalabas na dugo or ang tagal tumigil ng kanilang menstruation. So yun po yun yung mga sign ng blood deficiency. So kung may blood heat naman po, may init ang ating dugo. Tulad ngayon, napakainit ng panahon Blood can be hot. So yung dugo natin pero pong uminit. Mostly due to liver heat. Yan, pag uminit po ang ating atay, umiinit ang ating dugo. So pangunahin, paano umiinit ang ating atay? Kung lagi tayong galit. Yan, umiinit po yung atay natin. As liver stores blood, kasi siya nga po ang nag-store ng blood, liver heat or liver fire is transmitted to blood. So dahil po yung dugo ay nasa liver, naka-store, yung pag natutulog tayo ng 1 to 3, iniimbak yun ng liver yung dugo natin, kaya dapat tulog tayo sa panahon na yan, ng gabi. Then, iimbak po ng liver, siyempre dahil nasa kanya, kung mainit si liver, iinit yung dugo. So making it hot in women, blood heat often causes heavy periods. Yun po yung mga nagme-mens na ang daming nilalabas na sobrang mapulang dugo. Yun po. Yun sign ng may init po yung dugo. Tapos, nagkakaroon po ng mga skin disease due to blood heat. O, nagtataka po ngayon, bakit daw maraming lumalabas na skin disease? Pwede pong yung ating blood ay umiinit. Kaya, ang tendency po ng katawan, ilalabas niya yung init dahil ang init nandun sa dugo, yun, lumalabas po dun sa skin natin. Ito, yung clinical note po, to cool blood, use large intestine 11. And spleen 10. Kaya spleen 10 po, siya yun yung special point para sa dugo. Large intestine 11, nagtatanggal po siya ng lahat ng init or lamig na pumapasok sa ating katawan. Pag may blood stasis naman po, ito yung merong mga pagbabara. Blood can be fail to move properly, stagnate, nagkakaroon ng stagnation. Caused by stagnation of qi, mostly of liver, by heat or by cold. So ang blood stasis po, o ibang term ng stasis niya, nagko-congealed. So pwede pong hindi maayos ang pagdaloy niyan sa ating ugat dahil sa lamig or sa init. So pag nakaramdam po tayo ng blood stasis, masakit po ito. Often causes pain. So, ang clinical note po natin to invigorate, kailangan po nating i-move yung blood. So, gumamit po tayo ng kidney 14, spleen 10, at liver 3. Yan, yun po yung mga points para tanggalin po yung mga pagbabara ng dugo o blood stasis. Okay po. So, tingnan po natin ang ibig sabihin blood in TCM. From a TCM perspective, blood ensure we have nourishment and moisten for entire body. So kung malusog yung ating dugo, nanonourish niya at maganda talaga yung texture ng mga balat natin, hindi yan dry. So blood keeps our tendons, skin and hair healthy. Yan, kaya kung gumagalaw tayo, kung ayos po yung ating blood, madali nating irrotate yung mga buto natin, mga tuhod, mga joints, walang sakit. Skin and hair, healthy, strong, and flexible. So, kahit magpatambling-tambling ka dahil malusog yung iyong mga tendon, wala pong pain. Tapos, ito rin po ang blood, nag-lubricate sa ating joints and allows for smooth movement. So, blood nourishes the mind. Strong blood ensure good sleep and help us wake feeling rested. So, dahil ang dugo ay namamahala dyan ang ating heart din sa pag-circulate, ano. So, kung maayos po yung dugo natin, masarap ang tulog natin. Yan. At pagising natin, talagang feeling natin rested. So, kung hindi mo nararamdaman yun, may problema po o yung ating dugo. Our mind is nourished, so can remember things easily and feel more grounded in our thought. Yon. Kung hindi tayo kulang ng dugo, sapat yung dugo sa katawan, hindi tayo makakalimutin. Kaya pag makakalimutin na po tayo, magpatingin na po tayo kasi possible pong kulang yung ating dugo. So our reaction, focus, and memory are sharp. Madali kang makaalala kung ayos ang iyong dugo sa katawan. Okay po. How blood is produced and stored. Tingnan po natin. Food is received and ripened by stomach, then transformed by spleen into nutritive qi or yung food essence. So pag kumain tayo po ng mga, dapat po masusustansyang pagkain na, yan, masusustansya at balanse. So ita-transform po nito ng spleen, magiging po siyang nutritive qi. Yan, yung food essence po yun. Tapos food essence is sent up to lungs where it combined with air. Then, yung pag nag-grind na po siya, nutritive qi, yung ating hinihingang hangin, siyempre dapat yung hangin hindi polluted para healthy yung hahalo dun sa ating nutritive qi. Then, here, lungs and heart transform nutritive qi and air into blood. Then, pagdating na po dun sa my heart, magiging blood na siya. Which is then, isi-circulate na po ni heart sa ating buong katawan. Kaya kung healthy food ang kinain natin at hindi polluted ang ating environment, tiyak ang ating blood ay healthy. So blood is then stored in liver and sent out when it's needed for activity. Then, yun nga po, pag natutulog tayo at balance yung kinain natin, balance yung paggalaw natin, hindi tayo sobrang trabaho, i-stored po uli ni liver. Pag kumain tayo uli, i-stored niya. Tapos, kung gumagalaw na tayo uli, syempre sa umaga kikilos na tayo, yun, mag-re-release na uli ng blood si liver, dadalhin kay heart at isi-circulate upang tayo ay may lakas sa buong maghapon. So, ganyan po ang ating diagram. So, food and water, bababa sa spleen natin, transform and transport. So, yun yung gawain po ng spleen, napakahalaga, Kaya kung nagkaroon ng problema, ang gawain ng spleen na hindi na niya kayang mag-transport, magkakaroon ng suliranin ng paggawa ng blood. Then magiging food essence po yun. Yung food essence, acts on food essence, then acts on food essence, magiging po siyang ihahalo niya sa, yun yung pupunta sa blood. Yung gene essence po, ito yung nasa kidney nakalagay. Nung pinanganak tayo, enerhiya po to na nasa atin from the parents, sa ating tatay, sa ating nanay. Yan. Then, pupunta po yun sa liver, sa bones, then magpuproduce po ng bone marrow. Then yung bone marrow, so po yun yung ng blood. Ganun po yung diagram kung paano nagagawa yung blood. Okay po? Maraming salamat po. Sana po may natutunan tayong muli.
Thank you very much, Ma'am Mildred. Do we have any questions? Okay.
Kaya ngayon, Dok, na sobrang init, marami rin taong hindi makatulog. Pumapasok po sa katawan ngayon yung init eh. Kaya pag po, dapat umiinom ng tubig. Tapos yung mga pressure point, kung wala tayong needle, kung tayo acupuncturista, dapat po pinapressure para i-release niya yung heat. Pangunahin po ngayon napasok sa lungs. Kaya maraming inuubo.
Yes. Kaya daming na-stress din. Anyway, thank you very much, Ma'am Mildred, for that very wonderful presentation. Up next is lump tongue diagnosis. We will now call on Ma'am Teresita Sumile to discuss the relationship between tongue body shape and tongue coating. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. Last week, we talked about tongue body color and tongue body shape. Now, let's talk about the relationship of tongue body shape and tongue coating, okay? While shape and color of the tongue body are inseparably linked in tongue diagnosis, the body and coating of tongue are not quite so tightly connected and occasionally can be judged independently of each other. Tongue coating reveals location of illness. According to the 8 principles, it shows whether the illness is situated in the exterior or interior. The thickness of the tongue coating indicates its excessive or deficient nature. Okay? Color and texture of coating reflects whether it is hot or cold. For example, a slippery yellow coating suggests the presence of damp heat, while a dry yellow coating indicates the predominance of heat. In acute illness caused by externally contracted cold, indicated by a thin white coating, it is mainly tongue coating that shows strength of pathogenic factor and how deeply it has penetrated into the interior. Okay? Just by observing tongue coating, quality of pathogenic factor can be ascertained without necessarily having to consider the color of the tongue body. Besides changing the tongue coating, a strong penetrating pathogenic factor may also alter the moisture as well as the color of the tongue. Strong heat, for example, can cause a dry red tongue body. In mild chronic illness, tongue coating reflects underlying pattern of disharmony. Often a swollen, pale tongue body is accompanied by a moist white tongue coating, while a red tongue body is accompanied by a dry yellow coating. However, this is not always true because in severe cases, a red tongue body may present with a white powdery tongue coating, which indicates the presence of heat instead of cold. When diagnosing acute disorders characterized by fever, flu symptoms, or acute digestive problems, the tongue coating takes precedence over the shape of the tongue body. It is especially important to note the thickness, location, texture of tongue coating. Okay? Now let's go to observation of sublingual veins. It is always important to examine the sublingual veins and to note their color and thickness. The patient should touch the palate with the tip of the tongue. If the veins are clearly blue, filled, or swollen, this may indicate the presence of blood stasis in the body. Now let's take a look on the tongue of the patient, female, 33 years old. As you look at it, her tongue is pale, swollen, and has teeth marks. The patient presents symptoms of watery stools in the morning without smell, frequent nausea, no drive, intense feeling of cold, migraines, diarrhea, and vomiting preceding menstruation. Background to this disease. She has been treated for a long time with tetracyclines for acne vulgaris and had frequent illnesses in childhood. Okay, then Western diagnosis, none. TCM diagnosis, spleen deficiency with accumulation of dampness. So spleen deficiency with accumulation of dampness is manifested with a pale tongue body color with swollen tongue body shape and has teeth marks. Then the presented symptoms of watery stools in the morning without smell, frequent nausea, no desire, no drive, intense feeling of cold, migraines, diarrhea, and vomiting preceding menstruation, which are all signs and symptoms of spleen deficiency with accumulation of dampness resulting from a background of being treated for a long time with tetracyclines for acne vulgaris and had frequent illness in childhood. Okay, now let's go talk about signs and symptoms of spleen deficiency. So these are poor appetite, slight abdominal distension after eating, tiredness, lassitude, desire to lie down curled up, pale complexion, weakness of the four limbs, loose stools, edema, feeling cold, and has cold limbs. The tongue is pale and wet, pulse is weak and deep. Key symptoms are loose stools, feeling cold, cold limbs, and tiredness. Now, points recommended are same as for spleen Qi deficiency with in addition with spleen 9, REN 9, spleen 28, and bladder 22. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We will now proceed to diagnosis by interrogation. We will continue with the mental emotional symptoms. This time we talk about the diagnosis of depression. Okay. Asking patients about feelings of depression should always be part of our questions about the patient's emotional state, and we should do this with sensitivity and tact. Some patients will not want to admit to being depressed. Some will admit to being depressed but do not necessarily want to talk about it. And others may not even realize they are in a state of depression. These patients often will complain only of physical symptoms like extreme tiredness, lack of motivation, feeling cold, preferring not to face up to the fact that they may be depressed. In China, this is more the norm than the exception, as Chinese patients will seldom complain of feeling depressed, and somatization of their feelings of depression into bodily symptoms is often seen. In patients who are not aware of being depressed, Chinese diagnosis enables us to recognize the true condition of the patient's mental emotional state. Certain signs that point to mental depression as the root cause of the patient's problems are, so we will be looking at the signs that will really point us to the root cause of the depression. Complexion, the eyes, the tongue, the voice, and the pulse. The complexion of a severely depressed person will lackluster, and they tend to be grayish or greenish. The eyes will also lackluster, shen. The tongue will have red tip and may have a deep hard crack. The voice will be low and lacking vitality. The pulse in a depressed person varies according to whether the condition is full or empty. In full or excess conditions, the pulse feels very wiry or wiry and slippery. In deficiency or empty conditions, especially when there is sadness and grief, the pulse is weak or choppy, often short and nearly always lacks a wave. So this is called the sad pulse. Very often, the pulse of a depressed person may point to the true cause of the problem being repressed anger. In fact, in some cases, a depressed patient may display many signs pointing to an empty or deficiency condition like low voice, dull complexion, slow movements, while the pulse is very wiry. So napaka-importante po ng pulse, no? So this indicates that the patient's depression is due to repressed anger. So bawal po mag-repress ng anger. It will cause depression. Especially if nahihiya ka sa cause kung bakit ka nagalit. In contrast, a pulse that is choppy, short, or sad indicates that the prevalent emotion is at the root of the depression is sadness or grief, no? So it all depends on the pulse. So let's try practicing that when we see our next patients. In my experience, karamihan talaga, they may not want to admit that they are depressed. And I have seen patients who had so many complaints, but to no avail, walang nangyari. So you will have to feel the pulse. If there is repressed anger, wiry yung pulse. Although you might see a patient that looks very weak, low voice, sad looking. But this is, so when you check the pulse, it will be wiry. So it's it's very big contrast to what you actually see, no? So if you have a choppy pulse, sad pulse, or short pulse, that means there is a prevalent sadness or grief. Of course, when you are sad or grief, this could cause depression. In Chinese medicine, mental depression was called yin yu, which means gloominess or depression, or yu zheng, which means depression pattern. Yu has a double meaning of depression and stagnation, which implies that mental depression is always caused by stagnation. The simple questions in chapter 71 mentions the 5 stagnations of wood, fire, earth, metal, and water. The essential method of Dan Qi describes the 6 stagnations of qi, blood, dampness, phlegm, heat, and food. It says, when qi and blood are harmonized, no disease arises. If they stagnate, diseases arise. Many diseases are due to stagnation. Stagnation makes things accumulate so that they cannot flow freely. They would like to rise but cannot. They would like to descend but cannot. They would like to transform but cannot. Thus, the 6 stagnations come into being. So the complete book of Qing Yue gives stagnation an emotional interpretation and talks about 6 stagnations of anger, pensiveness, worry, sadness, shock, and fear. This confirms that all emotions, remember this, will lead to qi stagnation. In the 6 stagnations, stagnation is the cause of the disease. In emotional stagnation, the disease or the emotion is the cause of the stagnation. Okay? So either way, talagang merong stagnation involved. Any questions? Okay, kung wala pa rin, we will now proceed to pulse diagnosis. Let's welcome again Ma'am Mildred. Good afternoon, Ma'am Mildred.
Magandang hapon po muli. Patuloy po natin ating pag-aaral sa pulso, pulse diagnosis. 86 na po tayo. How to take the pulse. Okay. So, paano po tayo magpupulso? There are various factors to take into consideration and preparation to be made before you take the pulse. The client should sit or lie in a comfortable position. So, kailangan po muna paposisyonin sila ng komportable. Hindi po pwede yung nakaupo o ay nakatayo o nasa initan. So, that therapist should also sit or stand in a position that is relaxed. This is because diagnosing the pulse can take a long time, and if the patient stands and uncomfortable, this will affect the pulse. So pareho po yun dapat yung manggagamot, yung acupuncturista, dapat ayos din yung pwesto niya at yung pasyente, lalo na yung pasyente. Kasi nga, kung hindi siya nakarelax, maaari pong yung pulso niya ay mag-iiba. Halimbawa, naiirita siya kasi hindi maayos yung pagkakapwesto niya, pwede pong bumilis yung pulse. Yun. So if you are not positioned comfortably with relaxed arms, this will affect your concentration. So dapat nakapatong po ng maayos yung kanyang kamay kung may patungan tayong may armchair. Yun, para mapupulsahan natin ng maayos. The patient wrist should be level with or lower than their heart. So hindi po mas mataas sa heart ka-level or medyo mababa ng konti. So, kaya dapat po nakapatong ng maayos yung kamay ng pasyente. Place the middle finger on the radial artery next to lung 8. So, naalala po nyo yon, yung sukat ng kamay ng pasyente, tinitingnan nyo kung gaano kalaki yung fingers niya kasi yun yung pagbabasehan nyo na dun din nyo itatapat. Yan. The front finger proximal to the crease on the wrist of the base of the tenor eminence of the rear finger. So meron po tayong makikita sigurong drawing dito kung paano ipapatong. A similar distance proximal to lung 8. So yun po ipapatong dun sa may palapulsuhan. The distance between the position depends upon the person's build. In a children, it may be necessary to use only 2 fingers and afterwards palpate the different positions separately with 1 finger. Kasi nga kung bata, mas maliit po yung fingers niya. Kaya kung tayong mga acupuncturist o manggagamot, malaki yung finger, tingnan po nyo, i-consider po natin yun. Okay po. So, napakahalaga pong naka-align ang length ng 3 fingers. So, yung middle finger po is longer than the ring and the index finger and therefore it must be slightly bent. So if the middle finger is not bent, it will press harder against artery than the other 2 fingers. And this will give a false impression of the one position strength. So dapat po medyo nakabend ng konti para kasi kung madidiinan mo, so pag iba po yung position, then yung deep na yung mararamdaman mo, yung pala superficial pa lang. So dapat po nakaposisyon ng maayos yung kamay. Start by noting the impression received from all 3 positions as a whole. This will give you a general idea of the pulse overall quality. So papakiramdam mo po muna yung lahat ng quality ng pulse. So nakalagay po yung 2 kamay mo doon sa kamay ni left and right ng pasyente. So it can be a good idea to write down the first impression you get from the pulse. Halimbawa, pag patong nyo yung kamay nyo, naramdaman nyo agad very strong. Yan, isusulat mo na po yun. Very strong, strong. Yan. Take note of whether the pulse correspond to the expectation that you have with regards to the person's body type, gender, age, and so on. May guide na po tayo Kung nakita natin na napakapayat, naasahan po talaga natin minsan dyan, weak yung pulse. Yan. So, pag nakita natin yung tang, halimbawa nauna natin tinignan yung tang, nakakita na tayo ng maraming heat, asahan po natin yung pulse niya ay may fast po yan. So, afterwards, you can lift 2 fingers so that only 1 position is being felt. So, kung hahanapin mo na yung organ na affected, isa-isahin mo na po yun, ilalagay mo na yung kamay mo. Halimbawa, may ubo. Ngayon, pagkatapos ng general mo munang pinakiramdaman yung buong pulse niya, halimbawa naramdaman mo fast, then puntahan mo na yung ng lungs. Papatong mo na po yun yung kamay mo sa right, yun po yung lungs, ipapatong mo na. Then, i-confirm po nito, halimbawa nakita mo dun sa tongue is red, ma-possible din pong fast ang kanyang pulse sa lung area or sa kanyang tune. Sa left po yun So, focus on the sensation below the tip of the finger and not side of the finger. So yung tip po ng finger natin. It is important to be aware that a strong pulse in the neighboring position can pulsate on the other side of the finger and give the impression of a pulse position below the fingertip that is stronger than it is really is. Kasi nga po, di ba may mga katabing organ yan? Kaya yung tipo yung nilalagay natin kasi para maramdaman natin yung mismong eksaktong organ. Kung hindi daw po kasi yung tip, yung side ng finger ang ipakiramdam mo, baka yung kabilang organ yung nararamdaman mo. Kaya yung tip po ng finger yung ating pinapatong. Okay po. Then, roll the fingers back and forth and from side to side. This is to measure the breadth and width of the pulse and to feel qualities such as slipperiness and wiriness. So, hahanapin mo po medyo niro-roll mo yung kamay mo para maramdaman mo. Karaniwan po ang slippery, pumupwesto siya sa spleen stomach kasi yun yung nagpo-produce ng phlegm tsaka sa lungs. Yan. Pag wiry naman po, karaniwan po yan pumupwesto sa liver. Kasi yung wiry, halimbawa mayroong may mga stagnation of liver qi, wiry po yung nararamdaman natin diyan. Pag may mga dampness sa spleen stomach, slippery po yung mararamdaman. Press your fingers downward and gently release the pressure. Again, to get an impression of the depth. So, yon. So, para maramdaman mo pa yung lalim, pinapakiramdaman po natin. So, it is important to be conscious of the sensation of the fingertips. Paalala po muli, fingertips po yung ginagamit, hindi yung iba-iba pang part ng ating daliri. While both pressing and releasing the pressure, it is often releasing the pressure that you get the clearest impression of the superficial pulse and the wiry pulse. So una, patong mo muna. Kung nasa superficial, pag patong mo, mararamdaman mo. Kung wala naman siyang superficial, yung sa middle, then deep. So in general, the clearest impression of depth is obtained by repeatedly freezing and releasing the finger pressure. So pag nagpupulso po tayo, hindi po mabilis na makukuha. Inuulit-ulit po yan para matama po yung iyong pagdadiagnose sa pulse. So kailan didiinan mo, then i-release mo para maramdaman mo kung nasang level yung pagpintig ng pulso. Nararamdaman po yon. Let your fingers rest gently on the pulse so you can feel the speed and rhythm of the pulse. So, halimbawa po yung level ng deep, nakadiin po yung kamay nyo, pakiramdaman po ninyo, medyo tatagal kayo ng konti doon para maramdaman ninyo anong klaseng pulse yung andoon. Fast ba to? Wiry? Yung mga ganun po yung mararamdaman. Then, counts the beats. Yan. Kailangan po nating i-counts yung beats ng pulse. So, allow ample time to feel the pulse. Repeat the above procedure more than once. The pulse can be volatile and some of the qualities can change whilst you are feeling the pulse. This in itself can be diagnostic sign. So, kaya po yung pantulong natin yung pulse plus yung tongue, then yung ating interrogation. Dapat magtama-tama po yun. Pag alam natin na may heat in the stomach, spleen, dapat makita natin sa pulse na fast. Kasi kung hindi sila magtatama, balikan po ninyo, baka mali yung pagkatingin ninyo doon sa kulay or doon sa pagkakapulso ninyo. Okay po. Note, the various quality you have felt and the differences between the various position and depths. The following should be noted. Whether the pulse has shen, stomach, and root. Yun. Yung parang yung pulse na parang may lakas ba siya, para mararamdaman ninyo kung very empty siya. Yun. Tapos yung depth of pulse, kailangan pong tinitingnan yung lalim. Ito ba ay superficial, middle, or depth? Yung lawak, width of the pulse. Kasi yung napag-aralan natin, di ba? May rolling pulse, napakarami. Yun. Tapos yung lakas, strength of the pulse. Full ba to o empty? Mahalaga po yun. Kasi kung empty, yung points natin ginagamit, nagtotonify tayo. Pag full o puno, napakalakas siya nararamdaman, nagsasedate. Yun yung kahalagahan na alam natin yung quality of pulse. Then yung bilis, rate of the pulse. Nagsasabi din po ito ng heat or cold. Yan. Rhythm of the pulse, yung rhythm, wiry ba to, slippery ba to? Kasi nagsasabi ito ng mga pathogenic factors o sanhi ng sakit na pumapasok sa katawan. Halimbawa, yung pag naramdaman natin yung rhythm niya nagiging wiry, alam natin na merong stagnation. O pag naramdaman natin na nag-i-slippery, may phlegm or damp, yun po yung sinasabi. At tingnan pa natin yung other qualities. Nagpuputol-putol ba to, na normal ba dun sa rhythm? Kasi may mga sign po yun, kung hindi normal yung rhythm ng pulse, possible po pati yung heart ay kasi nakakonect po yung pulse sa pintig ng puso eh. So makikita natin doon kung may sign and symptom din yung kanyang heart. So yung Kun Guan Qi po yung position. Ito po yung tatlong level Kun Guan Qi. So may mga organ na nakatapat. Okay po, maraming salamat. So kailangan po nating i-practice yan. Mag face-to-face na lang po doon sa clinic, naladok sa lamp. Okay po, salamat.
Thank you very much, Ma'am Mildred. No questions. Let us now proceed to differential diagnosis, and let's call on Ma'am.
Doc, paalala po pala sa pagpapals, dapat nakaras mo ng pasyente, hindi pagdating ipapals agad. Kasi baka pagod, ibang makukuha.
Yeah. Okay. Thank you very much po. Next, we go to differential diagnosis. Let's welcome Ma'am Needs you. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector, and good afternoon, everyone. How's my voice, Doc? Medyo
Clear,
okay lang?
very clear.
Okay. Thank you, Doc. So, welcome to our TCM Foundations number 188. Nandito na tayo sa lung patterns, okay? Lung heat, okay? So, ang etiology or causes, interior heat from yin deficiency or qi stagnation from chronic emotional strain, invasion of external pathogenic heat, okay? Underlying pathology, lung yin deficiency, invasion of lungs by wind heat, lung qi stagnation, okay? Sign and symptoms, may ubo, cough, slight breathlessness, medyo hindi makahinga, feeling of heat, nainitan, chest ache, may pain sa chest, flaring of the nostrils, thirst, and face, pagkauhaw. When you palpate the pulse, it is overflowing and rapid or rapid, okay? Yung tongue, kapag tinignan nyo, may red with yellow coating. So remember po. Treatment, principle, enrich yin, clear lung heat. Okay. Acupuncture treatment points, lung 5, clears heat from the lungs. Lung 7, restores lung descending functions. Lung 1, descends lung qi, elevates the cough. And bladder 13, supplements lung qi. Magka-partner yan, lung 1 and bladder 13. So lung 10 clears heat from the lungs. And lung LI11 or large intestine 11 clears heat. Okay? Ang gagamitin yung gagamitin yung technique ay needle with drainage. Okay? Please remember. Thank you very much, everyone.
Thank you very much, Ma'am Needs. Mukhang may lung heat din kayo.
Yes, Doc. Lung heat.
Talagang related na emote na.
Tama.
Kasi ito nga ngayon, Doc, grabe yung init kasi po.
Sige. Laban lang. Okay. Maraming salamat po, Ma'am Needs. And then we now proceed to acupuncture patterns and practice. Let's welcome again Ma'am Teresita Sumile. She will talk about dysentery.
Good afternoon po ulit, Dr. Hector and classmates. Welcome po sa acupuncture patterns and practice. Now let's talk about dysentery. Dysentery is the syndrome of abdominal pain, tenesmus, and diarrhea with viscid red or white grains, as well as pus and blood in the feces. It occurs most commonly in summer and autumn. When blood predominates, it is known as red dysentery. When white viscid grains of pus predominates, it is known as white dysentery. If pus and blood are comparable in quantity, it is known as red and white dysentery. Okay, now let's go to its etiology and pathology. The causes of dysentery as an illness are principally exogenous pathogenic evils in intemperate diet. These two often occur together and interact. The main exogenous pathogenic evils causing dysentery are dampness, heat, pestilential evils, and cold dampness. When dampness, heat, or a pestilential evil invades, it injures the stomach and the intestines and can cause impairment of transportation and transformation, stagnation of qi, and stasis of blood. These interact with the accumulating heat poisons, and from this interaction arise pus and blood. in the intestinal tract and the feces. When cold dampness invades the stomach and the intestines, the nature of cold is to induce gelling, and that of dampness is to impede and make viscous. The interaction between these two processes leads to Qi stagnation and blood stasis, so that the fluids in the intestinal tract become viscid and mixed with the turbid contents of chyme. This also leads to dysentery. Intemperate diet is an important cause of dysentery. Excessive consumption of fatty, sweet, and deep-fried foods, excessive drinking of alcoholic drinks, or eating of unclean foods or drinks induces internal accumulation of dampness heat. Okay? Now, like exogenous dampness heat, this can lead to pus and blood in the intestinal tract and the feces. Excessive consumption of raw, cold fruits and vegetables or unclean foods can injure the spleen and the stomach. Insufficiency of the spleen in turn leads to internal accumulation of dampness and constraint on yang on middle jaw. Cold and dampness hinder intestinal function, causing stagnation of Qi and stasis of blood. Like exogenous cold dampness, this also leads to dysentery. Okay? Now, the main pathological mechanism leading to dysentery is the interaction between the visceral organs between dampness heat or cold dampness with retained foods. Okay? As a result of large intestine losses its function of transportation, impairment of descent causes impedance of Qi and blood movement, so that the fatty membranes and blood channels of the intestines become damaged. The illness may show a different set of symptoms depending upon whether it is due to dampness heat or cold dampness. In the case of dampness heat may be more severe than dampness more severe than heat, or heat and dampness equally severe. If dampness heat is especially severe and is intermixed with pestilential poison, the illness is called fulminant dysentery. Fulminant dysentery. If it extends to the stomach, it may become dysentery with inability to eat. In the latter two forms, there are danger of loss of consciousness and collapse. Persistent dysentery may lead to deficiency of genuine Qi and lodging of the pathogenic evil. Dampness heat may injure heat blood and produce dysentery of yin deficiency. Cold dampness may injure yang Qi and produce dysentery of yang deficiency. If genuine Qi becomes depleted before eradication of evil Qi, dysentery may become latent, breaking out intermittently. Okay? Now let's go to clinical manifestations. Dysentery is characterized by abdominal pain, increased frequency of defecation that is difficult and of small volumes, tenesmus and viscid grains of pus or blood. These are common to all forms of dysentery and are essential for the diagnosis of dysentery. Dysentery may be acute or chronic, though the acute form may develop into the chronic form, and the chronic form may show acute exacerbation. Care must be exercised in diagnosis. In general, acute dysentery is mainly seen in summer and autumn, while chronic dysentery can be seen in all seasons. Okay? In its early stages, acute dysentery presents a typical clinical picture, while chronic dysentery is often atypical. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. If there are no questions, we will proceed to signs and symptoms. Okay, this time we will talk about yellow lips and dry or cracked lips. Okay. First, we have yellow lips. So the first thing that you will consider is damp heat in the stomach and spleen. Yellow, no? So the lips are bright yellow, plus sticky taste, dull yellow complexion, feeling of fullness and pain of the epigastrium and lower abdomen, poor appetite, feeling of heaviness, thirst without desire to drink, nausea, may loose stools with offensive odor, feeling of heat, dull yellow complexion. Red tongue with sticky yellow coating, pulse is slippery rapid. So another differential for yellow lips is cold dampness in the stomach and spleen. So dull yellow lips plus dull yellowish complexion, sticky taste, abdominal pain, feeling of cold in the abdomen, cold limbs, feeling of fullness and heaviness, pale tongue with sticky white coating, slippery, slow pulse. Next is full heat with blood stasis. This time, we will have dark yellow lips, feeling of heat, thirst, abdominal pain, headache, chest pain, reddish purple tongue, wiry or choppy and rapid pulse. Other symptoms and signs depend on the organ involved. Next, we go to dry or cracked lips. So medyo maraming nakaka-relate nito, no? So the first thing that you will consider is stomach and spleen yin deficiency kasi nga dry. Okay, so dry lips, there is also dry mouth, no appetite, or slight hunger but no desire to eat. Constipation with dry stools, dull or slightly burning epigastric pain, dry mouth and throat, especially in the afternoon, thirst but no desire to drink or a desire to drink in small sips. Slight feeling of fullness after eating, normal colored tongue without coating in the center. Pulse is floating empty. So we can also consider full heat. So you will have cracked but red and swollen lips. Thirst, dry stools, feeling of heat. Obviously, the tongue is red with yellow coating. Overflowing, rapid pulse. Heat of the lungs, stomach, spleen, and large intestine may cause cracked lips. Other symptoms and signs depend on which organ is involved. Then we consider also yin deficiency with empty heat. So medyo matanda na yung patient dito. Cracked and dry lips, dry mouth, night sweating, 5-palm heat, thirst with a desire to drink in small sips, feeling of heat in the evening, red tongue without coating, floating empty and rapid pulse. Empty heat of the lungs, stomach, spleen, and large intestine may cause cracked lips. Other symptoms and signs depend on which organ is involved. So pwede ring liver blood deficiency. So this time, if you have a female patient, slightly cracked and dry lips, dizziness, blurred vision, floaters, numbness, or tingling of limbs, scanty menstruation, dull pale complexion, tongue is pale, choppy, or fine pulse. So pwede rin magkaroon ng dry lips or cracked lips ang blood stasis, no? But this time, the lips are purple. Dry mouth with a desire to drink without swallowing, headache, chest pain, abdominal pain, purple tongue, wiry or choppy pulse. Blood stasis of the heart, lungs, stomach, or liver may cause cracked lips. Other symptoms and signs depend on the organ involved. Because there is an interchange between blood and body fluids, severe long-standing blood stasis impairs the metabolism of body fluids and causes dryness. So dry lips are often a sign clinching the diagnosis na meron pong spleen Qi deficiency ang pasyente. No? So tingnan natin kung dry ba yung lips natin. Thank you very much. Questions? Okay, kung wala pa rin questions, we will continue with atrophy syndrome and we bring back Ma'am Mildred. Good afternoon po, Ma'am Mildred.
Hapon po muli. So, atrophy syndrome. Identification of patterns and treatment. Identification of pattern and treatment. Generally speaking, acupuncture is more relevant than herbal medicine for the treatment of atrophy syndrome, as it provides a direct and immediate stimulation of Qi and blood in the channels. Herbal treatment, however, provides a useful adjuvant to the therapy. Before discussing the treatment of individual patterns, we can discuss the general treatment of the channels with acupuncture, as this is basically the same for all patterns, except for the differences and needling method used. So, simple question. Suggest using predominantly points from the bright young channels, o yung stomach and large intestine. Yung main points po dito ay lang stimulate ang Qi and blood, then eliminate pathogenic factor from the channels in atrophy syndrome as follows. Kasi nga kung may nakabara doon, possible pong kaya nag-a-atrophy, hindi nakaka-flow ng maayos yung Qi and blood. So pag sa arm po, ito po ang gamitin natin, points to stimulate Qi and blood. Large intestine 15, large intestine 14, large intestine 11, large intestine 10, triple Warner 5, large intestine 4, small intestine 3. So sa arm po yan, pwede natin gamitin. Pag may atrophy naman po sa legs, gallbladder 30, gallbladder 31, stomach 31, stomach 32, gallbladder 34, stomach 36, stomach 41, and gallbladder 40. Yung other points pa po natin pwedeng gamitin ay yung sa baksyo, itong bladder 32. So then do 3, then do 12, do 14, and what 2 GI points, the stomach 30. Yan, very mga effective points po yan. So yung large intestine 15 po at saka large intestine 14 ay important local points either to remove obstruction from the channel or to tonify Qi and blood in the channel. So pag ginamit po natin yun, nagto-tonify, nagpapalakas siya. So, a good needling sensation should be obtained, preferably traveling downward at least to the elbow. Dapat po maramdaman ng pasyente natin yung sensation na yon, na yung Qi talaga ay traveling downward, papunta po dun sa elbow. So yung large intestine 11 naman po, benefits the sinews. Then large intestine 10 is an important local point for lower arm. So similar to large intestine 15 for the upper arms. However, it also has general tonic properties, somewhat similar to but weaker than stomach 36. Yan. Triple Warner 5 naman po ang ating ginamit. Ito po ay nag-aalis ng obstruction dun sa mga channel. At saka nag-aalis po siya ng wind. So, makakadali po ng maayos yung Qi and blood. It is therefore also used in the late stage when there are spasm. So, kung yung may mga parang nang namamanhid po siya, so gagamitin po yon in the muscle. Triple Warner 5 po, directly related sa gallbladder po yan. So, within the lesser yang. So, therefore po, influences the sinews. Okay. Yung large intestine 4 naman po at small intestine 3, ito po ay local points. Siyempre, pag ginamit natin parang ASI points, affect the hands and finger. A small intestine 3 also expel wind and therefore useful in the late stages disease. So kung meron na mga spasm sa kamay, make writing and holding things very difficult. So yun yung mga nahihirapan na pong igalaw, ihawak. So gallbladder 30 naman po ay very important point para sa pagtotonify ng qi at saka blood sa channel or upang alisin ang mga obstruction from it. So it also has general tonic properties ng papalakas. It must be needled with the patient lying on the side position. Nakatagilid po siya, no? To the one being needled and is essential to obtain the good needling sensation. Kaya pag nagni-needle po tayo, tinatanong natin yung pasyente kung may nararamdaman na siya. Dapat may nararamdaman siya, qi. Preferably all the way down to the foot. O, dapat may mararamdaman siyang papababa dun sa paa pag tinusukan po natin yan. At least to the knee. Kasi kung wala siyang maramdaman, nire-direct po natin yung needle. Tsaka yung ating stimulation. So, gallbladder 31 po is a local point to stimulate qi and blood and also benefit sinews and expel wind. Pag stomach 31 naman po, important point po to sa pagtotonify ng qi and blood sa channel. Particular, upang facilitate the raising of the leg, which is important when the person has difficulty in walking. So, yung mga hirap na lumakad, tusukan po natin is stomach 31. Okay po. Pag stomach 32 naman po, ito yung local points ng stomach channel. So, na-affect blood vessel. Gallbladder 34, ginagamit po ito para sa general effect ng mga sinews, yung mga tendon natin. Stomach 36, syempre most important point na nagtotonify ng spleen stomach in general. Pag stomach 41 naman po at gallbladder 40, local points for the foot. In particular, they facilitate the lifting of the foot, which is important when the foot is dropped and dragged along, making walking very difficult. So yun yung mga halos hindi na maitaas yung paa nila. Ito pang gamitin natin, stomach 41 and 40. Pag bladder 32 naman po at saka do3, stimulate ang circulation ng blood saka qi sa legs. So pag do12 and do14, corresponding yung Watu JG points may be chosen to affect the spinal nerve. Sa likod po ito, ginamit ko na po yan, very effective din siya. According to distribution of symptoms. Besides that, do12 tonifies qi in general. And do14, nagtatanggal siya ng hangin. So, stomach 30 po, nagpapalakas ng stomach channel at nag-promote ng circulation of nutrients, substance from the stomach to limbs. So, sa mga payat po yan, pag ginamit natin yung stomach 40, isi-circulate niya yung nutrients. Then, sa chapter 44 po of simple question, prescribe the use of bright yang channels to treat atrophy syndromes. It says, the bright yang is the sea of the 5 yin and 6 yang organs. It irrigates the original sinews which run to the pubic bone and up the spine in the back. And thus, there are several reasons for choosing points from the stomach channel. Firstly, they have general tonic properties. So, nagpapalakas, nagtotonify ng stomach. Kasi doon ang gagaling yung source ng postnatal qi, yung mga pagkain natin. Secondly, yung bright yang channels abound in the blood. So, pag ginamit po natin yon, andun din nakalagay yung maraming supply ng dugo. Thirdly, the point is stomach 30 is also choosing point with the penetrating vessels. Ito po yung chongmai. So that reinforcing this point is strengthen the stomach and penetrating vessel, and as well the so-called ancestral muscle, songjin, which gathers around the pubic bone, and that goes through stomach 30 and then up to the spine. Yun po yung ginagawa ng stomach 30. Then in fact, simple question goes on by saying, the penetrating vessel is the sea of the 12 channels. It irrigates the rivers and valley. Example, channels and muscle, and it meets with the bright yang at the ancestral muscle. Yin and yang channels meet here and converge at stomach 30. Yun, kaya pala mabisa yung stomach 30. Which is on the bright yang, the girdle vessel, daimai, and the governing vessel, dumai, also converge at this point. Thus, when the brachium is deficient, the ancestral muscle are weakened. The girdle vessel does not fasten and atrophy syndrome result. So, gagamitin po natin yung stomach 30 sa mga payat. The sum of reinforcing the point is stomach 30 will promote the circulation of nutrients, substances from the stomach downward to the legs and upward to the sinews and ligaments along the spine. All the above points can be used according to symptoms in any type of atrophy syndrome, respective the pattern. Further choice of points and herbal prescription depends, of course, on the pattern involved. So, pwede tayo mag-prescribe ng mga herbal kung ano yung makikita nating pattern, tsaka siyempre sa food. So, yun po. Thank you at napakahalagang gamitin ng stomach 30.
Thank you very much, Ma'am Mildred. And I'm sure maraming natutunan tayo this afternoon. If there are any questions po? Okay, if there are none, we will see you again tomorrow at the same time. Thank you very much for joining. Thank you po sa ating mga presenters. Good evening, everyone.